Could you have a vaccine as soon as November 1st? Joining us now to discuss is Dr. Jeffrey Lieberman, Chair of Psychiatry at New York Presbyterian Columbia University Medical Center. Good to see you. Thanks so much for coming on. There's this talk about getting the vaccine possibly distributed, if there is one, by November 1st for those frontline workers. What are your thoughts on that?
You know, Sean, it's sort of like forecasting who's going to win the next playoff game or championship game or tennis match. Everybody's talking, but nobody really knows. So the question is, what are the steps that have to be taken in order for that to be able to be done? First, the results of the phase 3 trials of the vaccines have to be analyzed. So they're still collecting those data. They haven't collected the data and followed people long enough. When they have the data, they analyze it for safety and effectiveness. Once they have a vaccine they believe is safe and effective, they then have to produce the amount of the supply needed on a sequential or a massive basis. But ultimately, it's 7 million doses, but obviously there may be batching it in certain amounts. And then you have to distribute it to the doctors, to the clinics, to the pharmacies for the implementation. So the date that you have a victory in terms of a safe, effective vaccine and the date that it's actually been administered to the population are different. And so it's possible the results could be available in November of 2020, but the implementation will certainly not have been completed till well into 2021 at the earliest.
Doctor, I'm curious to get your thoughts on this. You've got anti-vaxxers out there, and then you got folks that just are plain and simple worried about taking the first dose of this, if you will, and it is getting rushed out. How many do you believe would actually take this vaccine, the first batch of it coming out? Do you have concern about that? Do you think even though we get a vaccine out there, the number of people that taking it, it may not have that big of an effect?
Well, you're right. There is a psychology and a sociology. It's not just the infectious disease and vaccine science. Well, let me say this. I certainly wouldn't be taking the Russian vaccine anytime under any circumstances. But if our CDC and NIH vets it, and FDA vets it, and says it's good to go, sign me up, I'm first in line, because that means that the risks are greater than the benefits. And I mean, the benefits are greater than the risks. And to people who are anti-vaxxers, categorically, you know, that's just fantasy. You know, you're believing in anti-science, and I don't think it's really in anyone's best interest. So I would say if it's vetted by our government agencies and scientists and government scientists, then I'm the first in line.
Talk to me about the efficacy of this, the possibility of it, because and compare it, if you will, to the flu vaccine and the efficacy rate of the flu vaccine. What is a hopeful efficacy rate for this potential COVID-19 vaccine?
That's a great question. The answer is we don't know. So, you know, you're too young, but when I was a kid, everybody worried about polio. And then we had the polio vaccines, and we never had to worry about it again. So that was an enduring vaccine that lasted a lifetime. Other vaccines require boosters at some interval, and then other vaccines are seasonal, like the influenza vaccine. The COVID-19 virus is a family of viruses we have familiarity with, but this specific virus is a stranger to the neighborhood. So we can't say exactly whether the immunity that's conferred by a vaccine will be long-lasting or need to be re-administered at some frequency. In terms of efficacy, I think the benchmark that infectious disease doctors and vaccine experts use is anything over 50% is good enough. It doesn't give you complete immunity, but it gives you good enough so that it's worth taking and administering, and the cost and expense.
Obviously, there's the health toll that this takes on the body. I want to talk to you about the mental impact of this disease and what this has had for those facing lockdowns, for those that can't go out, specifically the elderly are tragically faced with not being able to be around loved ones. What are you seeing? What are you hearing about this? Is this getting better now that some of the states are letting up? What are your thoughts?
Well, you know, the analogy I would use is like an earthquake. We've had an earthquake, which is the COVID-19 pandemic, and the fear there was against getting sick, the contagion, how bad will it be if I do get it, and will I die? But then there are the aftershocks, or the tsunami if you're in an island. And the tsunami and the aftershocks are going to be largely neuropsychiatric, meaning the effects on the brain and the mind. This is something that we can predict with a pretty high degree of accuracy because all we have to do is refer to data from earlier natural or human-made disasters. So 9/11, Hurricane Sandy, the Great Depression, the Spanish flu. And you can see the incremental rates of suicide, addiction, domestic violence, depression. So there's going to be a second shoe that's going to drop. It's going to be a big one, and it's going to be largely neuropsychiatric. I think people have recognized that, but nobody is doing anything about it. Nobody is talking about what we could do now in advance to preempt the consequences. And I fear that by being late to the game, it's going to be worse than it needs to be.
Yeah, the focus on COVID alone, not the mental impacts of this whole thing, which remains to be seen, as you're alluding to. I appreciate.
And you were correct when you said there's going to be certain groups that are more vulnerable. So the two groups I would point to are the elderly and children. This is going to have a generational effect on children because it's going to stunt their educational, their social, and their cognitive maturational growth.
Yeah, a chief concern of many parents out there that we've seen when you see these school delays and the kids, there's pictures of kids trying to learn online, some of them are crying, they're frustrated, and not to mention being able to care for your children if you have to go to work. It's quite a bit of a mess. Dr. Jeffrey Lieberman, good to see you. Thanks so much for coming on. We appreciate that.